This is Dr. Steve Cohen. I'm continuing a concept of all disease relates to the brain and nervous system. All disease relates to the brain and endocrine system. All disease relates to the interrelationship of how our brain is working. Because when we say dis-ease, we're talking of being out of that pleasure zone. Our purpose here is, how can we feel more in touch with ourselves? How can we feel more connected? And if all brain disease, that 1 out of every 3 people are dealing with anxiety and depression, is a misfiring or not enough signaling in our brain, by taking more medication, would it make sense that that would improve the signaling? Now, signaling, when it gets down to such a low level, the body eats it. It actually eats the brain cell that is not firing up to normal. There's a 10-to-1 ratio of glial cells to actual brain cells. Glial cells are cells that are phagocytic. They actually grab the brain and start chomping on it and eating it. Meaning that if you're feeling depressed or anxious or a sense of like just sleepy or foggy, those firings are not happening. So the body has its own cleanup mechanism. How does it clean up? It uses glial cells. So you can Google glial cells. It's a 10-to-1 ratio. Matter of fact, half the weight of your brain is these cleanup people. And they go in there and actually gobble up your brain. If you're not using your brain to create happiness, those happiness cells or those pathways get eaten up and it becomes harder for you to be happy. If your purpose in life is to have joy and happiness, connectedness, and a sense of peace in your body, then medication is not going to be the answer long term. Now, obviously, if there's that much damage to your brain and central nervous system, it is an answer. But if you don't regain some of the neural tissue and you don't deal with the causes of this, the misfiring or the overwhelming of your central nervous system and your brain tissue in what we call the intermediolateral horn, which creates an irritation of our vagal functions, our organ functions. So now our bladder doesn't work properly, our bowel doesn't work properly, our gut doesn't work properly. And we start to see a dysregulation where there's becomes holes in the gut lining. Now what we know is that if there's holes in the gut lining where things can sneak into our bloodstream and attack us, then we also know that those holes go on in other barriers in our body, such as our brain. So it's a cascade effect. So we want to dampen those. And if we can slow the episodes of anxiety, depression, and irritability and add calmness, peace, and less trauma to our bodies, then we have a sense of wellness, a sense of peace, and our body can be restored by actually balancing the right and left side of the brain, by working with the factors that create the irritability and the inflammation. We can speed that process up. So give me a call at 329-PAIN. Again, this is Dr. Steve Cohen talking to you about the effect of the brain on your sense of joy. Thank you.